So, patient-reported outcomes are essentially any outcomes that need to be directly reported by the patients. So, rather than taking a blood test, for example, where we can take it to the lab and find out what the levels are, some things we actually need to go to the patient directly to ask them about them. So, it includes things like, for example, their level of distress, their level of anxiety and depression, what symptoms they might have, levels of fatigue, for example, levels of pain, other sorts of symptoms that are more accurately given to us by the patients themselves. And we know that it's really important to include patient-reported outcomes in our care of patients because, studies over many, many years, including, from 20 years ago when I did research in this area, told us that oncologists and other health practitioners are actually not terribly good at picking up on those issues. And it's more important that we ask patients directly what their issues of concern are, what their levels of various symptoms are, etc. And that's really what patient-reported outcomes are all about, getting it directly from the patient's voice so that we can respond to the issues that they've identified as concerning.